My name is Derek Cunningham, and welcome to another edition of PROspective. We have some of the leading authorities here to give you some insight into general asked questions throughout the sports vision industry and vision enhancement industry. Today, one of the topics that we're really going to jump on is the idea of contact lenses. Now, contact lenses have been a favorite of athletes for years, simply because it provides them a lot more visual freedom and better peripheral vision. Now, Keith, one of the questions that we're asked as doctors, probably more so by our colleagues, but also by our patients, is, are contact lenses necessary for sports, and what is the best one? It's a super loaded question, but give me your basic response that you would give a eye care practitioner that was just getting into sports vision.
Yeah, I think you make a great point. I think contact lenses, certainly the plus side of contact lenses, the peripheral vision enhancement side of it, compared to some kind of a sports glass or something where you might have some restriction in the periphery as far as the frame itself or the lens itself. I talk to the patients, I talk to the parents, I talk to the coaches about the benefits of disposable contact lenses, specifically one-day disposable contact lenses, the safety in a dusty, dirty environment, a sweat covered environment of a way to stay safe, with players that are on the road, on road trips and things like that, where we don't want to have eye infections and issues. So daily disposability is a great thing. I love the idea of UV protection in contact lenses. That's one of the things that we can do with certain lenses today. We talk about astigmatism that can now be done. Can you put an astigmatism in a contact lens? We can do just about anything in a contact lens today. So for me, the only downside of a contact lens is that we don't have the protective factor that we would with protective glasses on. So there are some pluses and minuses to both. But to me, it's certainly a big part of what we talk about day to day with youth and professional sports is contact lenses. And I definitely strongly agree. I think it's got a place.
So, Fraser, to add to that, though, coming on top of it, do all spectacles or do any spectacles limit peripheral vision?
So I think, if you have a thicker plastic frame, those temples are going to block your peripheral vision. There are some that have a higher wrap, if you will, that go around the eyes that may help you with peripheral vision, but you're always limited. You're limited by that lens and the frame, wherever it's at when it comes to glasses. So contact lenses helps reduce that peripheral limitation in the grand scheme of things because it lays right there on the cornea. And for me, when I work with my athletes, I'm discussing, single-use contact lenses. But also what I do is I talk to them about talking with their trainers. So that way the trainers are sitting there and they have a backup pair of contact lenses for when they're on the field. Because the last thing I want is for them to get contact lens tears or something in their eye and then they accidentally pull it out and it falls on the ground. Let's just get them an extra pair of backups, and that helps out quite a bit.
Well, from a trainer standpoint and from an athlete standpoint too, there is some aversion to putting a prosthetic medical device in your eye. From our profession, I think we'd all trivialize contact lenses because we see so many patients that are so successful with them. But in sports vision, wouldn't you agree, both of you guys, that we run across maybe a disproportionate amount of athletes that have to overcome a fear factor with contact lenses, and then once they get into it, they really feel like, my gosh, what you've opened up for me and my increased clarity, my ability to perform is really remarkable. How do you get around that?
I think sometimes you don't. Unfortunately, there are certain individuals that are wearing, sports glasses, and very successfully so. And I think a lot of times that is an anxiety thing. I think it is difficult sometimes for certain individuals. I can speak to certainly plenty of pros through the years that I had to put contact lenses in for them because they couldn't do it. So, to me, I think, there are a certain amount that will never get over that. The other side of that is finding, to Dr. Horn's point, the right contact lens for them, the most comfortable lens material, the most comfortable fit, the easiest lens to insert. Sometimes a smaller diameter lens might be a little bit easier to put in. Sometimes a little stiffer lens. It's not as floppy on the finger that might not, fold over so difficult and be difficult to put in. And so I think it's finding the right fit for the athlete, giving them the best chance at it, and look, challenging them, right? They're athletes. So at some point you need to sit down and go, let's take the bull by the horns and get this thing in. And, I can tell you how many times in spring training we sat in the locker room, bathroom with a mirror and an athlete and a contact lens and sat there until we found a way. So if the mind over matter takes over, these guys are where they are for a reason. And if they want to do it, a lot of times they can find a way.
And I think one of the things that's helped with that also is I've worked with our trainers to do insertion removal training of contact lenses. That way they're also comfortable in case one of the athletes is new to wearing contact lenses. They feel a little more comfortable with taking them out or putting them back in if they need to. So it's another service, and it just helps with the trainer feel more comfortable with that as well.
Well, I think that's great. I think, one of the points that I like to reiterate a lot to a lot of my athletes and trainers as well is contact lenses are probably the closest you can get to the natural human visual system if you can get a good fitting lens. And so, I think it's by far optically and physically the best thing that we can do vision-wise for an athlete is to move them as if they were born with perfect vision. And I think that's as close as we'll ever get. And certainly huge jumps in materials and technology. And I think let's end off there. If you could give us or give our colleagues just a little bit of an insight on really the jump that's happened, not only in materials and solutions, but in really our concepts on how we fit athletes that, really has moved this into a mainstay, not just a fringe thing with athletes.
Yeah, so for me, I think that the development with how daily single use has rapidly increased the amount of options that we have, and that's been huge for us. But I also think the ability for them to be comfortable for a long amount of time and in different environments is huge, because if you have an athlete that's wearing a contact lens and they're drying out within 30 minutes of wear, they're not going to wear them, right? They're not going to be comfortable. Last thing I want is an athlete worried about their contact lens while they're performing. So I think the material and the way that they've developed the optics in them have definitely made it so that way they see better. I think some of the things we also do is we'll occasionally over minus during sports. We may give a sports specific contact lens outside of their normal everyday contact lens. And for those that play evening games, night games, that may help with that improving contrast as well.
I think the other important part is the timing of the fitting as well, right? So, with youth sport, before your season, with, coordinating with high school, collegiate, professional trainers, making sure that, that we're a part of those preseason evaluations, of preseason physicals, that, if you do identify someone that could benefit potentially from vision correction, that, you have those 6 weeks of spring training or those couple of weeks of preseason camp to actually work with the athlete and get them over that hump of comfortability, to a point where they can actually take that lens out there, feel good with it. The last thing we want to do is put on a lens mid-season and say, go on the court tomorrow. That's just not going to happen. And, you want it to feel like a part of them. So the more that you can get that lead up to the season and give them a chance to really use it in their comfort zone and kind of build up their wearing time is something I think that's important too. So the timing is critical.
All right. Well, thank you very much for joining us for another edition of PROspective. We hope you come back and join us for the next issue looking into how to enhance vision performance.